Testing. Hello? Testing. Hello? Testing. Good morning. I think we're all set. We're back. This is our regular Saturday morning yoga therapy session. We have been doing it for a long time, and as all of you know, we're doing this session from our experience, from our research, and with the outcome driven, the therapeutic outcome of a daily regular yoga practice. Today's topic is yoga therapy to rejuvenate. It's a wonderful topic. To give you a little idea what the rejuvenate means, we all who are practicing a daily regular yoga, we definitely rejuvenated. Rejuvenation basically means becoming younger. We are younger. We are younger in our body, mind. We can do everything what a little baby can do, and we are literally converted into a young baby or an infant. And as you all know, the origin of yoga as a therapy derived from the babies. If you see the babies of the yoga poses, like an infant, the way the infant sleeps, it is called the way the infant sleeps, that's the way we sleep. Also, yogis also sleep in a different way called a yogic sleep. Baby will lay down and then put the feet high up, hold the toes, and this is called your happy baby pose called Ananda Balasana. Ananda means happy, Bala is a baby, Asana is a pose. Baby will get up into a cobra pose. Baby laying down will show you the boat pose. I have pictures of all of them from a candid camera, but now I see it all the time on my grandchildren and also other babies and the infants, and I watch, and we watch them all the time. When you rejuvenate, you will be able to sit down in a squatting pose. You will be able to get up very easily from sitting to the standing pose. And as all of you know, yoga as a therapy is a philosophy. It is called Yoga Sutra of Patanjali. It is small aphorisms, 196 aphorisms, of which 193 is to quiet down your mind. And the practice is called Patanjali Ashtanga Yoga. Ashtanga means 8 limbs. And we as a teacher, we memorize the whole 8 limbs. Yam, social restraint; niyam, personal restraint; asana, external and internal alignment; pranayama, voluntary regulated breathing; pratyahara, control of your 5 senses; dharan, focus; dhyan, meditation; samadhi, union of your body, mind and spirit. We practice all the 8 limbs, but primarily we do asana, pranayama in the meditation. Let's start a practice which will convert you to rejuvenate. First and foremost, a regular practice of yoga will cause compression of the morbidity. Compression of the morbidity means we are all mortal. By the time we grow, we are going to have a lifestyle related disorders, increasing in the blood sugar, diabetes, increasing in the blood pressure, hypertension, increasing in the atherosclerosis, blockage of the arteries, your high cholesterols, your insulin resistance. But a practice of yoga which is a relaxation response, the activation of parasympathetic tone, will compress them at the end of your life. So what happens, you get a quality living. We became younger and younger, and we live a longer and longer life. We also collect all the data, all the information based on our practices. We have been teaching for hundreds and thousands of people, and we also teach now all online. We have been doing called yoga therapy retreats for all of you who is in our listening and viewing area. Our next yoga therapy retreat will be on April 10th, 2022 from morning 8:30 to 4. And just for your information, probably all of you know by now, we have 6 teachers within us. Out of the 6 teachers, 3 of us are physicians. Other 3 are certified yoga therapists, and we all have a health tracker. Like I have this Apple Watch. When we practice, we all have the health tracker and we watch our health parameters. This is exactly like even if you're doing a stress test, you're on a treadmill, you have a monitor looking at EKG here, you're doing it, you can always do a EKG on your own. Here is the one, you can go, I can do let's see if I can see my baseline EKG. It's coming up. I can see, and when I will be performing, when I'll be doing, and I will have my EKG monitor from my Apple Watch, and I will be also having my heart rate monitor from this Apple Watch. Just done a 30 seconds EKG strip on my own, and it shows exactly a sinus rhythm, and it shows the heart rate around 80s. So we're good to go. Okay, as I mentioned to you, that first and foremost, rejuvenating practice is going to be our how to sleep. Sleep is the rejuvenation. During sleep, first of all, physiologically, our body inner core temperature comes down. You get a profound relaxation of your skeletal muscles. During sleep, you have a release of your growth hormone. But interesting about sleep is that Sleep has a two component. One is called a REM sleep, which is called a rapid eye movement sleep, which is your mind is still awake. All the dream takes place in a rapid eye movement sleep, which does not rejuvenate you. That is about 25% of your sleep. 75% of your sleep is called a non-REM sleep, non-rapid eye movement sleep, of which you have 4 stages: stage 1, stage 2, stage 3, stage 4, which are from your light sleep to the deeper sleep. Stage 1 and 2 is almost 50%, and stage 3 and 4 is about 50%. Stage 3 and 4 sleep, where you get all the benefits. So even if all the health tracker, this also have a sleep tracker. Now let's go ahead and see how do you sleep. First, throughout the whole day, we maintain a daily routine, which is called a dinocharya. We have gone over with you before, and if you want to see, you can go to my YouTube channel and you will see multiple YouTube about dinocharya. But basically is wake up in the morning, and we generally sleep on our left side and with a fetal position. The reason for it, sleeping on the left side of fetal position opens up your right nostril, which is a heating suranari, and it balances the lowering of the inner core temperature of our body. Inferior vena cava is on the right side, so when you lay on the left side, there is a more blood return to your heart, which is called a better preload, and with the relaxation response, you get a reduction in the afterload with an increase in the cardiac ejection fraction. So when you get up, you wait for a little bit. Don't get up too fast because you have a postural hypotension. Then you sit down in a malasana or squatting pose. Drink 2 glasses of water at normal temperature with a gulp. 1. With a gulp, it starts the peristalsis, and when the water goes into the stomach, you are sitting in a squatting pose, it stimulates called a gastrocolic reflex. Stretching in the stomach contracts your colon. You go for a bowel movement. And these days, I'm sure I have shown it to you with my commode. We also have it called squatty potty. Sit down like you're squatting. You get a very good bowel movement in the morning. You do a tongue scraping. You wash your called neti pot. Every morning we wash our nose with a neti pot called gel neti. Do our daily practice. We eat breakfast little late because of it is a kapha time. Lunch is between 12 to 2. We call it 10 to 2 because of pitta time. Lunch is really the main meal. 6 taste and 7 coloring fruits and vegetables. Fruit eaten as a separate during afternoon snack. Very light dinner. Half the size of your lunch. At least 2 or 3 hours before going to bed. Go to bed by 10. Drink a glass of water before that. When you first get into the bed, you sleep like a baby. Have you ever seen a baby? It's called supto baddha konasana. A baby will lay down on the mat, on the bed. If you have a problem, you can always put a little bit of a pillow underneath, but I'll show it to you. Then every infant, every baby, you will see, they will put the feet together like this and they drop it down. Personally, all of us yoga practitioners, we sleep like this. We start initially like this. Initially, you have some problem. We said we are not flexible, our hips are, you can put a little 2 pillows underneath and then stay here. When you stay here, slowly and slowly, what happens? You can see me? I don't see that. Yeah, okay. When you keep on staying here, neuroplasticity will set in and your knees will slowly and slowly come down and become comfortable. In this posture, then you incorporate your breath. Do between 5 to 10 breaths, breathing out longer than breathing in. Lung is like a balloon. It has a 6-liter capacity, needs 1.5 liter to keep the lung open. 4.5 liter you can exchange between breathing. Normally in our breath, we only exchange 500 milliliter or 0.5 liter. 80 to 90% lung function is reserved. So breathe out first. Take a deep breath in effortlessly. Breathe out longer than breathing in. Respiratory muscles are skeletal muscles. They can be trained. So slowly and slowly you will see your breathing will be deeper and deeper and longer. We used to learn initially 2 seconds in, 4 seconds out. Then we do 4 seconds in, 8 seconds out. We all go to 8 seconds in, 16 seconds out. We've been doing it for so long, we can easily do 10 seconds in, 20 seconds out. So we do about 5 to 10 breathing out longer than breathing in. Then we do the breath holding. Breath holding is about 1:4:2. And remember the physiology behind it is that when you prepare yourself for the sleep, like you go to sleep, sleep is a regular body habit. So sleep is a cycle. So I will go to bed at 10:30. Before going to bed, I'll prepare myself. Wash my face, then I will brush my teeth. Then we do the oleation of the nostril. We take a little oil and put the oil inside the nostril to keep the nose open. Because we sleep through our nose. When your nose is blocked because of the dryness, if there is a mucus get dry, nose gets blocked, you get a mouth breathing. Mouth breathing creates your snoring and a sleep apnea. So with the Jalneti, cleansing your nostril and a little bit of the nose, and we always say you sleep well when you have an oil and oleation in the nostril. We'll breathe out first, breathe in with a count of 4 in, hold the breath count of 16, breathe out count of 8. Breath holding increases your carbon dioxide in the blood, which is called your carbonic acid. Hypercapnia means more carbon dioxide in the blood has a narcotic effect. We'll do it 5 to 10 times, breath holding like this. Breathe out first, breathe in with a count of 4 in. Hold your breath for count of 16. Breathe out with a count of 8 out. Breathe in with a count of 4 in. Breathe out with a count, hold your breath for count of 16. Breathe out with a count of 8. After this exhalation longer than inhalation in the breath holding, which doesn't take much time, then you concentrate on the abdominal breathing. You will see a baby or an infant when they are sleeping, when they breathe in, you will see the stomach will rise like this. Breathe out, abdominal wall will go in. Continue this abdominal breathing. Remember, sleep has a lag period. When you go to bed, it takes about 10 minutes for you to fall asleep. If you go to bed and sleep right away, you are sleep deprived. If you cannot sleep beyond 30 minutes, you have insomnia. By the time you incorporate this abdominal breathing, breathing out longer than breathing in, breathing out is parasympathetic, breathing in is sympathetic, and breath holding is a carbon dioxide, CO2 narcosis. Initially, we switch back to your yogic sleep. In a yogic sleep, we sleep initially we sleep on the right side with a fetal position. So I will be on the right side and with my head, I'm in a fetal position. I'm breathing in and out. Sleeping on the right side, it opens your left nostril. Left nostril is cooling. Left nostril is your Chandra Nadi. Left nostril is your parasympathetic. Body core temperature is still high. Left nostril breathing does the balancing of the body core temperature. Once you started to falling asleep, your body core temperature comes down. You switch it slowly to your left side. Yogis generally sleep with your hand like this. We can put a little pillow, small pillow underneath, and generally you can sleep very well even without a pillow. Takes a little time. This way you open up your right nostril. Your body inner core temperature is down and right nostril is heating. It balances the cooling of the body's inner core temperature. Try to sleep this way. It may not happen in one day, may not happen in maybe in weeks, but by repeatedly doing it, you develop a habit, which is called a neuroplasticity, and you'll have a wonderful sleep. Once you sleep, is not the how long you sleep, is the quality of your sleep. When you get up, slowly get up, straighten up your right foot, right leg, and slowly get up, and don't get up suddenly. Give a little time to sit down next to your bed and let the body's physiological changes your adduct itself. So again, people ask me all the time, how long you're going to sleep? It's not how long you're going to sleep. What is your deep sleep? So if you sleep, say, 6 hours. Out of the 6 hours, you have about 4 hours, or say, what would be, maybe 4.5 hours will be your non-REM sleep, 75%, of which about 50% is stage 2 and stage 3 sleep. So basically you need about 2 hours or maybe a little over 2 hours of your deep sleep to rejuvenate yourself. We practice every single day this relaxation response and parasympathetic activation, and we as a yogi, we stay in the stage 1 and stage 2 of the sleep throughout the whole time. So when you are in relaxation response, when you're able to breathe effortlessly, which is a pranayama, you enter into a state of meditation. In the state of meditation, you are still awake with all the physiological benefits of sleep. So throughout the whole day, we are meditating. And remember, meditating is not closing your eyes and paying attention to your breath. Meditation will prepare your physical body. Sthiram, Sukham, Asanam. Very, very important. Stillness in your body. You'll feel happy. You will feel perfect pose. Here I am. When you sit down properly in sequence, in stages, you get into a proper asanas. Before you also balance. If you're able to sit down here, if you get a little pain, remember, there will be no pain and you have to be effortless breathing. You can back off. But if you stay here, close your eyes, do your breathing out longer than breathing in, and this thing will happen. All the questions about, I'm too young, I'm too old, I have a lot of arthritis, it is all the state of your mind. Mind controls your body. Keep doing it. Karo yog, rahane rog. Keep doing yoga, you will be disease free. From the disease, you will no disease. Rogi to nirogi, from nirogi to yogi, you will convert into yogi. Next, what the babies do when you rejuvenate and what the babies do, that's what you're going to do. Have you ever seen babies? Now pay attention to the babies. If the baby is sitting down, they will be always sitting down like this in a sukhasana. You will also notice baby will always change their feet like this because it balances both sides of your brain. What we do in sequence as a yoga practitioner, after that, this is called a easy pose. We'll take the heel to the back, we'll put our feet on the top, our knees drops down. If people that come and ask me, I cannot do it, I said, your mind cannot do it. Keep doing it. Neuroplasticity will set in. Okay? Next, you do the opposite side. See, in sequence you are doing. You are not getting into one position right away. So we take our time, and we have been doing it for years and years and taking our time. From here, you will go ahead and do your Ardha Padmasana or Swastikasana or half lotus. You'll do half lotus on one side. And when people say, I have a lot of cramps, I have a lot of tightness, suddenly happen. If you keep practicing this relaxation response, you your cramps will go away. And remember, the whole yoga practice, we call it a holistic. I do not practice for my feet. See, I'm relaxing. I put my feet, I separate my toes. This is the relaxation of my toes and feet. But this relaxes my whole body. You come back, you do it, your half lotus outside. I teach the children, children. Our group, we are 6 of us. We used to teach the children's group before pandemic. And we used to teach the children lotus pose. And children will sit down in a lotus pose. This is the lotus pose. I have 2 grandbabies now, and I'm showing it to my grandchildren. They're able to sit down in a lotus pose. This will rejuvenate you, because this is a relaxation response. People say, I'm tight. You're not tight. Your mind is tight. Keep practicing it. It happened to all of us. It will happen to you. Next, a baby, if you teach the baby yoga poses, you will see we have a lot of asanas chart. You get the asana, they will sit down in a squatting pose. Malasana. Even the babies on diaper, they'll sit down in Malasana and do their pooping. And you able to sit down in Malasana, put your hands together, separate your fingers. When you separate your fingers, your hands get relaxed. Remember, hand get relaxed when you're able to close your hand like a baby. Balo Mushti Mudra. Balo means baby, baby fist. Baby will put the thumb inside and close. We always close like this. If you say baby, baby will always put a thumb like this. Baby will scream on this hand gesture called mudra. Because this is also called Adhi Mudra. It opens the upper part of the lung. With the breathing, breathe in, breathe out. Breathe in, breathe out. Wonderful practice. Separate your fingers. When you're tight, your fingers doesn't go. But when you're relaxed, your finger goes through, your hand goes through all over. You can do all this stuff. Wrist gets relaxed with extension. Put your one elbow inside, other elbow inside. You literally keep your spine straight. Eyes closed. Breathe out first. Take a deep breath in. Breathe out longer than breathing in. Remember, all the disease we have, I am the cause and I am the cure. The day I was born or the day when the baby was born doesn't have any disease. Interaction with the environment, which is called epigenetics, creates a disease. Genetics does not cause disease anymore. If you have a genetic changes, like I have genetic changes of all inherited disease. My father has a diabetes, my father has a hypertension, my father has a cancer. I also have a genes for all of them. But that gene has to express. Genetic expression causes the disease. Dis-ease. Practice of yoga is epigenetics. It suppresses. It's a wonderful practice. From here you will see a baby. From here, baby will do 2 things. Baby loves to put the head down, or baby will love to get up from here. From here, they easily will go up without a support. And again, they will come down, sit down. They always put the head down. When you put the head below your heart, your physiological changes takes place. Your pressure inside the brain goes high up, called intracranial pressure. Pressure inside the eyes goes high up, called intraocular pressure. Pressure inside the blood vessels, carotid artery, aorta goes high up. But if you keep slowly and slowly keeping down, your baroreceptor sensitivity comes in and the pressure starts to come down. So I'll show it to you. Initially you won't be able to breathe, but how it happens. Then when you rejuvenate, as I said, when you become like a baby or become like a child, you will see laying down, they will do few asanas, which is a classic for the babies. So, let me see if you can see. If you can see me well first, babies would always do, not even babies, an infant laying down, they will do called it Ananda Balasana. They will hold on to their toes like this, and they keep doing it like this. It's called a happy baby pose. Ananda Balasana. Ananda means happy, Bala means the baby, Asana is the pose. Keep doing it. If you're doing it with me, keep doing it. You'll feel a profound level of relaxation. You know, baby doesn't do anything. This creates a physiological changes in their body and in their mind. They keep on doing it. Next, what a baby will do, rejuvenation, very important. Baby will do what is called your Naukasana, boat pose. To get the body high up, slowly your body will go high up and you stay like a boat. It's a boat pose. And you will see your body will be showing the effect of it. You will have a lot of fasciculation, twitching, but that will go away in time. Infant easily do a Setubandhasana, bridge pose. You will always see them put down your body like this and starts going high up. If you keep doing the same thing, what a baby does, we are guaranteed you'll be back to be a baby again. That's what happened to all of us. Jathar Parivartanasana, Markanasana, monkey pose, put your feet together, drop your knees on one side, and look at your other hand, right hand. And when the baby does, baby will sleep like this. I have a lot of pictures of the babies sleeping like this. And it's not getting in and out of the pose. You stay in the pose, you can completely relax. Then you can talk, you can breathe. It's called an effortless ease. To the opposite side again. Knees on the right side, looking onto your left hand. Then what rejuvenates you is that what the babies will do, they will always get your whole body high up. It's like your shoulder stand and a plow. They'll go high up like this. So we, when you get relaxed, will be able to do a lotus on a shoulder stand. On a shoulder stand, you'll be able to do a lotus, and then you'll be able to do a plow, halasana. This is another wonderful asana, modified Pavan Muktasana on knee chest. When the baby gets down, on the face down, they'll be doing first a called TV viewing pose. It's called a Makarasana. So this is a very common phenomenon. You'll watch a baby and you'll do it. So here you are, you're laying down, on your face down. Initially, when you put the face down, put our hands, slowly turn your head on one side. And you bring the relaxation. What is the relaxation? Is called one of the relaxing asanas. Show it to you. Let me show it to you first. You turn your face on one side. Bring your knees right angle to hip and hands right angle to that. Your hands on both sides. You can also put a hand on the one side, other hand to the other side. It brings a profound relaxation. Shakti Asana, strength. In yoga, strength comes from relaxation. More and more you relax, more and more strength. Same thing. Turn your head on the opposite side. One knee comes high up. Makarasana. In a Makarasana, the baby's version is called a TV viewing pose. Put your elbows together, and that's where the babies watch your television. You can incorporate your feet. You can put your feet together, breathe out first, take a deep breath in, bend your knees, try to touch your ankle to your hips and then drops down. Breathe in, breathe out. TV viewing pose for the babies, or we call it a Markanasana. Then they'll get into a Bhujangasana, cobra pose. Feet together, one hand on the top, you are relaxing. Slowly, remember, people ask me, how to do the breathing? Therapeutic yoga, breathing has to be effortless. You breathe in and breathe out as if you are talking, you are singing. So you'll be slowly able to go high up. Put your look high up and you talk, you breathe, you sing. This is a therapeutic yoga practice. And able to stay in the pose. If you cannot, come down. Find it out your position where you are. Start where you are, continue from there. You can put your hands on the side, breathe out first, and slowly get up in your cobra pose, Bhujangasana. One thing baby will do is called Dhanurasana, bow pose. They will hold both the ankle, body high up, and try to get the whole body high up. Dhanurasana. They also love to do balancing poses. And remember, balancing poses will create the balance between both sides of the brain. Getting up, they'll always get up in your downward facing dog. Urdhva Mukha Svanasana. So what happens, what I was telling you, that when you are able to get your body high up and put your head down, even if you can put your head down here, your head will get flushed. Your face will be red, eyes will start watering, and you won't be able to breathe. But if you keep your head down slowly and slowly, that neuroplasticity will set in. When neuroplasticity will set in, you will be always able to see your breathing will become normal. All the pressure inside the brain, pressure inside the eyes will normalizes, and you will be able to easily get up into headstand. We had so many times, we are doing a headstand practice, little baby will come, doesn't matter what age group, put the head down, trying to. So, regarding headstand, it is such a myth from our medical community. Don't do this when you have this age. Don't do this when you have this. Don't do this. No, don't do anything. Go home, take some pill and start digging for your grave. You prepare your body and mind, and you do it in stages and without any support and any help. So, the technique here will be, you will able to sit down, this asana called a Vajrasana, Thunderbolt. Thunderbolt is a very relaxing asana. You keep your spine straight, you support your head. When you are in a Thunderbolt pose, Vajrasana, you create a profound parasympathetic response. And all of our digestive tract from your mouth to your anal canal is supplied by your parasympathetic nerve. So this is one asana we recommend, and we have seen our parents and grandparents sit down after eating a big meal, after lunch, after dinner, to sit down in a Vajrasana. In a Vajrasana, when you feel a profound relaxation, this is your stance, you put your stance and do in stages. You are not pushing yourself and nobody is helping you. Clasp your hand, put your head down. And listen to your body's signal. If you have a pain, you can back off. If you cannot breathe, you back off. But if you can breathe, you can talk like what I'm doing, get your body high up. Stay again, keep walking. If you keep walking, you will see your body is going to go high up. So body is going to go high up. Don't push yourself. This is the teaching. We are doing it, that don't let anybody touch you. Your feet is going to go high up slowly and slowly in stages when your body and mind is ready. The biggest fear is a fear of falling down. And what you find out, only when you fall in the front. So, how to get rid of your pain? How to get rid of your fear? Let me see. Move this thing down the way. I'm sorry. Remember, you rejuvenated. You became like a baby now. So your fear has to go away. And how to get rid of your fear? Very simple. Look at me. I'm getting rid of the fear of my headstand. Put your head down and slowly put your body high up. Come down. See, what I've done, or what we're doing, is that you are under total control. In a total control, that you are listening to your body's signal and you did this, we call it a somersault, to get out of your fear. You'll be able to do your headstand. No. Headstand is a profound relaxation. Headstand is called the king of all the asanas, is a cure-all for all the chronic lifestyle related disorders. Babies will be able to get up. They will sit down from here. You will see, sitting from here, they will be able to get up without a support. You are becoming like a baby now. So, now we got up, and also you'll be able to see that you can be able to sit down. Wonderful practice. You'll be able to get up without a support. You balance yourself. You're comfortable standing in this position, separating your feet. Put your feet together. Going against the grain of your habit. Practicing law of opposite. Balancing, cross your feet. Crossing feet, you'll be able to sit down, you'll be able to get up. Rejuvenation. You don't rejuvenate until you are the baby. You act like a baby, think like a baby, and you became a part of the baby. Cross your foot opposite. You'll be able to sit down, get high up. Essentially, you'll be able to go all the way down into the ground and get up. We have a tremendous number of medical research showing able to get up, called sit, rise test, is better than even any stress test, any kind of other physiological changes. So the technique is you're able to sit down all the way to the ground. Your feet are all crossed. From here, you will be able to get up without a support. Balancing yourself, you'll be able to do it crossing in the opposite side. If you use one hand, you lose 25%. You can see on your parameters, you'll be losing everything with your hand. So when you get up like this, easily, you straight get higher. When you get high up, always keep your spine straight. Best way to keep spine straight, Dandasana, Jastyasana, put your feet against the wall, touch your back of your head, back of your shoulder, your hips and ankles, and slowly put your hands high up. Close your eyes, breathing out longer than breathing in. If you look at a baby, you'll see baby's abdominal breathing and breathing out longer than breathing in. Children will love to do a tree pose, Vrikasana. It's So the way to do the tree pose, you put your hands here, put your hands here. But let me tell you one thing. When we balance ourselves, we fall down in our hand, if you fell down. Eyes does your balance, also does your hand. So take your hands, put your hands in the back and put it in your, like a prayer pose. Paschim Namaskar. Put your hand like a prayer pose. Put your feet together. First and foremost thing, say if you're able to stand on one foot, especially on your non-dominant foot. I'm standing on my left foot. 10 seconds, 20 seconds, 40 seconds. Once I come to the 40 seconds, I do almost impossible job to stand. Close my eyes if I can do it. When I can keep my eyes closed and stand on one foot, this is the ultimate rejuvenation, ultimate cure-all for all the chronic lifestyle related disorders. I practice every single day, still I have a hard time doing it. Always balance opposite side. I'm standing on my right foot. Closing my eyes and see how long I can stay on it. 30 seconds to 45 seconds is a wonderful time to standing on one foot with eyes closed. Pranayama called Kapalbhati Pranayama, breath of fire, pushing your abdominal wall inside. It's a relaxation response. We don't practice pranayama, practice standing high up, but here we can show you that you are able to relax and do this balancing poses at the same time. So when you're doing a tree pose, precaution, put your feet here, with foot below, you can go it above your knee. Then you will notice if you put your hands like this, lot easier than putting your hands to the back. If you put your hands to the back, you will have a different balancing act. And from here, if you can do a Kapalbhati Pranayama, totally rejuvenate yourself. You cannot have any better practice than this. By the time you do it, you are in a profound level of relaxation. We wash our nostril every morning with a neti pot, what is called a gel neti. And we do get some drainage throughout the whole day, but it's essentially normal. So now we are going to do the opposite leg. Remember balancing. Now we're doing the opposite side. Same way, putting our hands to the back. Paschim Namaskar, a prayer pose to the back. And now bring a Kapalbhati Pranayama. Disease will be scared of you. Disease will come to you. This is like your antiviral software. When you buy a computer, you have the antivirus software. These are your antivirus software. Nothing will come to you. able to put your head down, and able to do it. Separate your feet and able to do Kapalbhati Pranayama at the same time. So you can keep your feet Prasharita Uttanasana, widespread head to the ground, head to the feet. Put the head down, all the way down. Holding both the feet and doing your Kapalbhati Pranayama. This causes a tremendous massage to your pelvic floor. So women with the pelvic floor dysfunction will have a wonderful effect from this. It also massages the prostate gland for the men. So men with benign prostatic hypertrophy will be very effective. Babies loves to do your Bhastrika Pranayama. If you teach the babies doing the Bhastrika Pranayama, they will keep on doing it. They love to do Kapalbhati Pranayama. And also they can do an alternate nostril breathing, Anulom Vilom Pranayama. You teach the 3 pranayama, or you keep doing the 3 pranayama daily. First you do breathing out longer than breathing in. Then if you keep doing your Bhastrika, in a Bhastrika, when you rejuvenate, when we are rogi, we do it very slowly. You slowly raise your hand up. But if you look at a baby, when the baby will do it, baby will take that. I had 100 of them. I could keep on doing it because we practice every day. But I'm breathing, I'm talking, I'm totally effortless. Therapeutic pranayama will be as if it's your normal breath. They can do a very rapid Bhastrika. That's a sign of rejuvenation. Remember, You're like a baby now. Act like a baby, think like a baby, and see what the babies will do. Babies will put their head down, downward facing dog. They will do a Shirshasana, headstand. They will do a shoulder stand, plow. This is very common for the babies. Same way, in a Bhastrika, this is the rejuvenating Bhastrika. Remember, people always ask me, you do it slowly. Yes, you start as if your normal breath. There is no time limit. Time limit is your how long you can do as if a normal breath. Yes, if we keep on doing it more and more, for us, every day 1 hour of practice, 25 minutes of asanas, 25 minutes pranayama, 10 minutes of meditation, 5 minutes of Bhastrika is a very good practice. 5 to 10 minutes of Kapalbhati pranayama, very good practice. 5 to 10 minutes of alternate nostril breathing is a very good practice. So here goes a rejuvenated yogi doing a Bhastrika pranayama. I just did a 400. Just for the sake of time, I could continue a lot more. I could do 1,000 easily. So effortless. That is your pranayama practice. You can get this hyperventilation syndrome. You can have some altered level of consciousness. You can have some circumaural numbness, carpopedal spasm. You have some globus. You have some pricks and needles in your body. Entirely normal. As long as your breath is effortless, other symptoms are not concerning at all. Those are called symptoms of hyperventilation. Your lung is completely empty. You can breathe out. Take a deep breath in. Completely breathe out. Baby, when they do a Kapalbhati pranayama, because they can do it, they're rejuvenated yogi is a baby. Initially do very slowly, 1 per second with all the hand mudras. If 10 mudras we do it, I'll do another pranayama practice, you will see. And if you want to see any, go back to my YouTube channel. I have a lot of presentations. Pranayama instead of medicine, what is the power of conscious breath, how to use yoga in your breathing difficulties. So they will be like this, say they're always in a baby fist, very relaxing. Normally it will be 1 per second, spine straight, eyes closed, mind quiet. What you also do when the children, when you notice it, we do a very rapid Bhastrika pranayama, rapid Kapalbhati pranayama, and they put them in a savasana. Child never goes to, because they're always restless mind. They have 100 things going on. So a child will do, a rejuvenated person will do like Kapalbhati like this. Continue that. For a yogis like us, we can do 500,000 very easily. For the babies, once they do it, then you put the baby on a savasana. In a savasana, we finish with the babies or our children. Then you separate your feet up to the width of your mat. Put your head down. Try to keep your head, chin below. Don't get the chin high. The chin goes high up, put something underneath your head. But if chin comes down, it's okay. Put your hands on both sides, palm facing high up. And what is noticeable from our experience, that if you let the child follow the breath, we said, bring your attention to your breath. Close your eyes and slowly relax. Our experience tells us that you're 4 years old, we do it 4 minutes, 5 years old, 5 minutes, 10 years old, if we can do 10 minutes, and then above that 10 minutes is good enough. It's not easy, even for a yogis to let down. Incorporate abdominal breathing. Bring your awareness to belly button. Raise your belly button with each inhalation, breathing in. Belly button will come down every exhalation. Continue this corpse pose savasana as long as you can without any effort. Then slowly turn on your left side. Put your head under your hands and straighten up your right foot and slowly get up without any support. So, it's wonderful practice. I urge you to do it. And I start with some small relaxation in stages. And in stages, impossible become possible. Sanskrit, we say, Karo Yog, Raho Nirog. Yoga is art of transformation. You keep doing it, you will have a profound effect from a transformation from a rogi, people with disease, to a nirogi, people free of disease, to a yogi who is enjoying a good quality living. We finish with a lotus mudra and palming and cupping. Put your hands together, eyes closed, touch your little finger and thumb, separate your ring finger, middle finger and index finger. This is called lotus mudra, padma mudra. It connects your body, mind and spirit. Bring it in front of your heart chakra, anahata chakra. Slowly bring it down towards your heart, which is the side of the soul. A daily practice of yoga, a routine practice of yoga, art of transformation from rogi to nirogi to yogi, and essentially rejuvenation into converting a human being to a baby and an infant. Act like an infant, act like a baby, and get rid of all the lifestyle related disease, which is I'm the cause and I'm the cure. Slowly bring your hands in front of your heart chakra. Put your hands together. I honor the divinity within you. You are divine. Rub your hands. When you feel the warmth in your hands. If you're wearing glasses, remove your glasses. Take the hands like a cup. Put it over your eyes. Let the eyes take all the heat from your hand. Then you massage your forehead. Massage your eyes. Massage your face. All the muscles here are attached to your skin. When all the muscle gets relaxed, the lines, we call it the 11 sitting here, all the eyebrows, all the lines, all the frowning, it goes away. Take your hand, massage your earlobe, massage behind your ear, in front of your ear, in fact even inside your external ear canal. There's a branch of a vagus nerve called the auricular branch of vagus nerve. It causes vagal stimulation, parasympathetic stimulation. Bring your hands, massage on both sides of your neck. It's called massaging your carotid sinuses. Massaging carotid sinuses is a profound relaxation response coming down cardiovascular system and nervous system. Take the hand to the back, massage to the back, where is the insertion of the sternomastoid muscle and the trapezius muscle, which are the nerve supply from the cranial nerve, accessory nerve, so your whole nervous system quiets down. It's a wonderful practice, wonderful experience. Keep doing it. Karo Yog, Raho Nirog. See you again next Saturday. And as I said, if I don't have any other assignment, I will be always here. We've been doing it for years and years. And any questions, any comments, please do it. I always do in my timeline, Facebook, I'm not too interested to put it on my whatever things you call to have thousands and thousands of people are looking at it. It is there for all the yoga teachers, yoga practitioners. It will get uploaded into the YouTube. You can always look at it, always make a comments and talk to me. See you next Saturday.